Murakoze cyane. Just keep it going for them. All right.
This is what happened in Rwanda in the last 1 month. And today, we're here. You are all safe. And Marburg is under control. And that we can break and be prepared even for any future outbreaks. This is a fact. I want also to highlight something actually crossed this morning. Hundreds of healthcare leaders, executives were asked one question about how the future healthcare will look like in the next 20 years. And the answer was, I'm going to read it. It was very unanimous from all of them. The future healthcare and why to improve to make our lives even better. Personalized, seamless, integrated, digitized, simplified, and we live longer, not just a number of years, but also healthier. In Rwanda, we've been integrating different programs and strategies, but I would say that health is the country. And this means doctors and IT engineers. We've been also establishing Health Intelligence Center, which is another way of applying technology to the highest level of bringing the solutions with the data and informations, making it easy to use for decision making, and also to protect the community at large from top down. And this center is artificial intelligence integrated, machine learning for predictive analytics and to inform policies and also to optimize our decision making. Secondly, there's no way you can improve and move forward with technology without partnership. And partnership has no limit. And that's the beauty of health, because health also has no limit. So we've been leveraging this opportunity to use technology into health to support them. I'd like to conclude by saying that with partnership, with friendship, with innovations, with supportive environment and coming together, continent, forward to your fruitful discussions and deliberations. I thank you.
Much, Honorable Minister. Now, for all of you who need translating devices, in case you've not picked them, they're here. To give the partner address, please allow me to call on stage Ambassador Belen.
The Honorable Minister of Health, Dr. Sabi, opening ceremony of this Africa Health Tech Summit in Kigali for the 3rd year in a row. It really is a pleasure to be part of this Health Tech Summit. Congratulations to the government of Rwanda, to the Africa CDC, and to Smart Africa for the excellent initiative and for their convening power. I'm delighted to see here today ministers of health from countries in the continent, national public health institutes, regulators, leading tech innovators, and researchers. It is you who can build the future health systems in Africa, who can improve health care services in the continent through technology and digital transformation. The third edition of this Africa Health Tech Summit in Kigali brings the opportunity to build collaborations and partnerships for innovation, to spotlight game-changing policies. And precisely this, fostering innovation and digital transformation to improve the access to health quality, is a shared priority of the African Union and the European Union and Team Europe, also here in Kigali. But before, I would like to take this opportunity to express my gratitude and to commend Honorable Minister of Health of Rwanda and the government of Rwanda for the proactive leadership in the management of the Marburg outbreak, for their rapid and robust response and the professionalism and resilience of the health workers. Rwanda is saving lives, is containing the outbreak, and is in Africa, and to recognize the remarkable progress in Africa, and to recognize the remarkable progress that has already been made, like the theme of the summit described it, is innovating for community health, and is about unleashing the power of artificial intelligence. Digital transformation recognizes the benefit of digital health, not only for healthcare, but also in terms of growth potential for the healthcare economy. Healthcare economy. The European Union, together with our members of the Team Europe and the EU member states, we are pleased we launched earlier this year a Team Europe initiative on digital health, coming together with Germany, with Belgium, France, Luxembourg, Portugal, Spain, and Sweden in an investment of more than 200 million euros, precisely to collaborate with African State, Africa CDC, WHO, and to support to make the best use of digital solutions to sustainable strengthen health systems. And to complement this, we've also been working on with public health institutes across the continent, including here in Rwanda. The digital transformation in healthcare sector is also making significant inroads into the regional vaccine and pharmaceutical production across the African continent. Technological solutions and innovation can speed up the access to vaccines, the vaccine equity, as per the African Union agenda. And together with Team Europe, we're very pleased to be part of this partnership. This is just a flavor of partnership. As the minister said, partnership is also what we stand here for. So with this, I would like to say that in the land of health tech innovation, in the land of drone zipline experiences, this summit will be addressing critical questions like strategies and solutions to strengthen health infrastructure, enhance disease prevention and surveillance, improve supply chains efficiencies, expand access to diagnostic and care, build health worker capacity, and drive progress. There's so much to discuss and to discover in the next 3 days. So with this in mind, I wish you all a very productive Health Tech Summit and look forward to these conversations. Murakoze Tani.
Murakoze Nawe, Ambassador Murakoze Chan. Now, the last few years have really tried and tested Africa's healthcare systems. A focal organization has been Africa CDC, and I know the mandate placed on Africa CDC has been huge. Who best, before we get into the conversation on accessibility of healthcare provision across different communities, who best to speak than Dr. Jean Kaseya, who's the Director General of the Africa CDC?
Good morning. I was here 2 weeks ago. I was using papers. They say, no, this is a digital meeting. You must use a digital tool. This is why I'm using that. My dear brother, Dr. Sabin, the Minister of Health, Rwanda, let me recognize also your twin sister, Minister Paula. I think both of you are doing an amazing job here. We'll talk about it. Let me recognize also our sisters who came from Uganda and Malawi. They are deputy minister and state minister from Uganda and Malawi. I think people, they will know you. We need to recognize you. My friend, Ambassador Belen from European Union to Rwanda, I enjoy all discussions that we have when we have to discuss about not only the support you are providing to Rwanda, but to the whole continent. Colleagues, dear friends, I think it becomes now a bad habit because my colleagues, they are frustrated. Now, I'm not reading their speeches because every time I have to speak based on what is going on. Today, let me first start by thanking all of you for flying to Rwanda and attending this meeting. Every day, I have to say, with the system in place in Rwanda, there is almost zero risk for Rwanda to spread the Marburg outbreak out of Rwanda. And that one, I made it a few weeks ago. I started to monitor. From that day to date, there were several meetings. I didn't hear someone flying to Rwanda and getting Marburg. Today, let me apologize because our MC said we are late. It's because of me. I apologize. I was engaging G20 Ministers of Finance and Health who are meeting in Brazil. I told them I decided to cancel most of my trips out of Africa to focus on our countries facing outbreaks. And for all of these meetings, I will use the virtual opportunity to engage them. I was telling them, don't apply travel ban. You are not safe because you are applying travel ban. You are safe because Rwanda is doing the great job. And that one, for the country to continue to do the great job, they need $175 million. We don't need your statement. We don't need your verbal support. We need your money to make this country responding to this outbreak and building a resilient system. Believe me, if Rwanda was not doing a great job, we will not be here today. And believe me, this region will be, not only the region, but the continent will be in a mess. Because don't forget, the case fatality in Rwanda is the lowest one if you compare the 10 other outbreaks, Marburg outbreaks that we had in Africa. By commending Rwanda, we are also commending our two champions, Minister Sabine and Minister Paola. When I was here in Rwanda, I had the opportunity to visit the Public Health Emergency Operations Center. I had also opportunity to visit the control room. I was just amazed. I was thinking today, under the theme, Innovating for Community Health, Unleashing the Power of Artificial Intelligence, I was thinking it would be around what Rwanda is doing. Colleagues, believe me, it will be a missed opportunity for you if you don't go to visit this control room. I was talking with the two ministers, I was talking with the Inspector General of Police last time, for you to go to visit and to see. That one will help you to know exactly what you need to do for our continent. Don't miss this opportunity. support fundraising for you. Because at the end, it's what all people in this continent and out of the continent are implementing to make the continent moving. This is why I was thinking that you are not today here, you have so many geeks here. I even don't know if I know 10% of what you know. Even I'm struggling with my Samsung to send data to iPhone. You can imagine. But for most of you, it's just a game. But we are here not to talk about our specific product. We are here to talk about a vision. What is the vision that we have for the continent? I will leave you with 3 dreams that I have. These 3 dreams that can take opportunity of the artificial intelligence to support the digital transformative agenda that we launched last year. What is the first dream? Yesterday I was meeting my colleagues from PATH. I think they are somewhere in this room. I was telling them, 70% of our outbreaks in Africa are zoonotic outbreaks, worsened by climate change. It means we need a strong One Health approach. Do we have a One Health management, information management